Hey everybody, it's Dr. Paul Thomas with Plum Health DPC. I'm a family physician and today I'm giving a coronavirus update. Today is March 26, 2020. It's Thursday and there's a lot that's been happening with the coronavirus lately. Unfortunately, the United States has 79,000 cases of the coronavirus right now with 1,143 deaths. That's a mortality rate of 1.4%. We talk about why the coronavirus is so concerning and so devastating to our population right now. And it comes down to two things: the rate of infection, how fast this can transmit to other people, and the mortality. So, for example, the flu has a mortality rate of 0.1%, and the coronavirus has a mortality rate across the country right now of 1.4%. It's higher in Michigan, and we'll get to that in a minute. Also, it's affecting about 2.5 to 2.9 people for every one person it infects. So if you get it, you're likely to pass it on to like 2.5 to almost 3 other people. And that's why it's spreading so quickly. And that's why we have to be really conscious about how often we go out of our house and how often we wash our hands and touch our faces. All right, so next up, let's talk about the stats in Michigan. We're here in Detroit, in Corktown, and we've seen a lot of cases in the city of Detroit and Wayne County. So the Michigan Department of Health and Human Services releases an update on their website every day at 2 o'clock. This is today's data, March 26th, Thursday. And you're seeing the majority of the cases, or many of the cases, are in the city of Detroit and Wayne County. It's the most populous region. We do have an international hub here, our Metro Detroit Airport. And you're seeing that there's 851 cases in Detroit, 15 deaths, and 538 cases in Wayne County and 11 deaths. Overall, in the state of Michigan, there's 2,856 cases and 60 deaths. And unfortunately, that puts a mortality rate in our state of Michigan at 2.1%. So for every 100 people who get this disease, 2 of them will die, which is really sad. And again, why we need to double down on staying at home, self-quarantine, washing our hands well, and avoiding getting in contact with other people. The state of Michigan also released some really important data, the number of negative cases, and that helps us to understand who's testing positive. And let's start with this commercial testing. So there's 30 positive tests from commercial labs. And that might tell us that, perhaps people who are seeing their doctor or seeing a health professional in an outpatient setting, only about 4% of those people are testing positive, versus the folks who are going to a hospital with symptoms that are severe enough to be directed to the hospital and to meet their testing criteria. About 35% of those folks are testing positive. And so, again, to refresh everyone, people who should be tested for coronavirus, those folks have a fever, some sort of respiratory distress like coughing or difficulty in breathing, and perhaps a contact point or recent travel history. So if you have a known contact, if you came into contact with somebody who has the coronavirus and you're concerned about it, and you have some other symptoms, it's likely that you should be tested. Some good news is that the city of Detroit just announced that they're going to roll out some large-scale testing. They're going to try to do 50 tests an hour for about 8 hours a day, or about 400 tests a day. And they're going to do that at the state fairgrounds. That's at Woodward Avenue and 8 Mile. And this is going to be a car-based, like a drive-through testing system. So in order to qualify for this, you must have a doctor's note stating that you should be testing for the coronavirus, and then you must call and schedule an appointment, or your doctor must call and schedule an appointment for you. You should be in the room at the same time to coordinate schedules and everything like that. That's kind of details, but it's important because this is going to be free testing. It's going to expand our capacity to test folks, and hopefully that will tamp down the number of infections in the city of Detroit and Wayne County. This is really important to test people because then we can understand who has the infection and help them to isolate themselves and protect the people around them. So maybe that person who is tested now knows that they shouldn't even go to the grocery store, they shouldn't even go to the doctor's office, they should just stay at home, take fluids, rest, take supportive care to help them get through this infection Therefore, they can prevent infecting other people in the community. This is all very concerning, the number of new cases, the amount of people getting infected, because we are starting to reach our capacity at hospitals. So there are only a certain number of beds in the country and in our states and in our region. And it's really tough to shift patients from one hospital, from one state to another, because every hospital, every city, every county, every state is facing this all at the same time. So it's not like we can send patients down to Ohio because they're dealing with coronavirus as well. So our beds are starting to fill up, and we have finite resources. We have finite number of doctors, nurses, respiratory therapists, beds, and respirators or ventilators. So as our capacity is reached and exceeded, we're going to have to make some really tough decisions that we should never have to make around who gets tested, who gets treated, who gets a bed, and ultimately who lives and dies. And these are really difficult decisions that we don't want to make. So again, this is the importance of staying at home, washing your hands, and keeping each other safe by self-quarantining and self-isolating. Okay, so another big question that I get is, how can I become immune to the coronavirus? This is a little bit of a tease because I answered this question for Channel 7 Action News. They're here in Detroit. They're going to be airing this answer at 6 p.m. unless it gets bumped by Donald Trump. If President Trump makes an announcement at 6 p.m., this will get bumped to their 7 p.m. and 11 p.m. news hour. But the short of this is that you can become immune to the coronavirus in two ways. One is you become infected and you recover, and then you're immune to this. And what happens is your body first produces IgM, and then it produces IgG. And IgG confers more of a long-term immune response, where if you see this again, you can't become reinfected. That's why we're seeing people not being reinfected with the coronavirus, because once they are infected, their body creates IgM, then IgG, and they become immune to this. The other way you can become immune to this is through vaccination. But it's going to take us 18 months to develop a vaccine to the coronavirus. And by that time, it may have spread, it may have changed. And so it's really difficult to see how vaccine is going to help us in the short term, and especially over the next year. We're not going to have a vaccine over the next year. It's very unlikely. The next question I've been getting a lot is, how will the coronavirus pandemic end? And this really comes down to this concept of herd immunity. We may have heard of herd immunity. Think of like a big herd of cows or sheep or something. If 50% of people or 60% of people are immune to the coronavirus, it can no longer spread to people in the community, because it no longer has enough vectors. It doesn't have enough people to infect. This concept of herd immunity is reasonably well illustrated by this graph. If you look at the left-hand side of this, this is what we're facing right now with the coronavirus. No one in our population is immune. Everybody is susceptible. The gray folks are susceptible. The red person's infected. And so it easily spreads to other people in the community. On the right-hand side, this is the concept of herd immunity, where the yellow folks here are immune to coronavirus, and therefore it can't easily spread in the community because people are already immune to it. These people have already developed antibodies. This could either be people who have gotten the virus and recovered, or those who have been vaccinated. This is another illustration of herd immunity, and this is really important for vaccines. Let's say influenza vaccine or measles, mumps, rubella vaccine. For measles, for example, we need to have a herd immunity of around 90% to prevent the spread. And so if we start dipping into the 80s or the 70s, that's when measles can come back. We saw this happen last year, 2 years ago, when there were outbreaks at like Disney World, etc. And so if you have a population where everyone's healthy but not vaccinated, the virus can spread really easily. That's what's happening now with coronavirus. But if you vaccinate everyone and somebody gets ill, this red dot, it's very difficult for them to spread the virus because everyone's vaccinated. Okay, so I'm going to wrap it up how I wrapped this up last time. What should you be doing during the coronavirus? Stay home, practice social distancing. That's kind of a amorphous term. So what does that mean, social distancing? Don't leave your house. Stay 6 feet away from other people, even if you go outside to exercise or jog or whatever. Only leave your house to buy groceries, visit the doctor, or get medications. Those are really the 3 biggest reasons to leave your house. Other than that, stay at home. To slow this down, how can you help slow down the coronavirus? If you want to donate any unused masks or supplies that you have, like gloves, donate those to the nearest hospital or doctor's office. If you are able to donate blood to the Red Cross, we need blood and plasma to help the victims of the coronavirus right now. Do not visit the elderly or vulnerable people in your community because you could be carrying this virus. Everyone should act like they have the virus and they can potentially spread it to other people. So the best thing to do is stay at home and socially distance yourself. That's keep 6 feet from yourself and other people. Thank you so much for watching today. Everyone stay safe and healthy out there, and best of luck to everyone. A special thank you to all of our hospital workers, doctors, nurses, respiratory therapists, and everybody who's taking care of people in this time. We really appreciate everything that you're doing. Take care.